is Kira. I'm doing a video on how to do a chest tube and just some information on chest tubes. So the purpose is to, I guess there's two purposes, or two types anyways. So there's a tube that's inserted into the pleural space, and that removes any air or fluid that got in there, so that way it doesn't mess with the working of the lungs as the different layers rub back and forth together. It doesn't mess with the negative pressure that causes the lungs to expand and deflate. And then the second type would be, that was taught, was a tube is inserted into the mediastinum space, which is placed under the sternum, and it's to drain fluid from around the heart after a cardiac surgery, since extra fluid and blood can get in the area and messes with the causes a patient to go into cardiac tapenada, I think, depend. So those are some reasons. Also, for chest tubes, they have for a pneumothorax, which would be air enters the pleural space and causes the lungs to collapse, and that can be from trauma or can be from something spontaneous. Sometimes it just happens. And then there's also a pleura effusion, where fluid enters the space and messes with the negative response, or the setting, and the different types really just depends on the type of fluid that's in the lungs. So the ones we have would be the hemothorax, which where blood gets into the lungs, and that's either from tuberculosis, trauma, blood clots, where it's not clotting and the blood's leaking into that space. And then there's emphysema, which is infection in that space, and then psilothorax, which is lymphatic fluid into that space, and that can happen with the cardiac surgery as well. So there's different systems for the drainage. There's the wet system, and then there's the dry system. And the wet system, the difference is there. It has a water chamber, and that's what kind of regulates the pressure. And you're going to hear, occasional bubbling with that, just because of the water, so it's working. Because otherwise, if you have it for the dry system where there isn't water and you hear bubbling, that's what you want to, pay attention to. So you'd want to see if there's a leak if you heard bubbling for a dry system somewhere. So that's pretty much like the difference between those, but it seemed like the positive one, the best one is probably maybe the dry system, just because it has a high pressure option, and there's no water that evaporates. You'll have to watch that for the wet system, and then you have to replace that because that can evaporate there. And then also no bubbling sounds that you really have to be suspicious of, except for, knowing that it's probably from a leak. So things to monitor as like nursing interventions, things to watch for, your patient's respiratory status, so the lung sounds, how fast they're breathing, difficulty breathing. They have to watch the drainage systems that we just talked about, what to do when the system breaks, and then watch for the look at the site to see if there's any infections there, and then also watch for the sub-Q crepitus, which would be when air escapes and, or like not air, but CO2 escapes and is in the tissue, and so it looks puffy, and then when you feel around it, it kind of feels crunchy, kind of like Rice Krispies. So kind of want to watch for that. And then the drainage system you want to keep below the patient's chest and make sure it's secure, because patients turn and they can dislodge the tubing and get tangled in that. Also want to make sure that there's no clots or fluid collecting in the tubing, and then note any color or the amount of output. You want to note that regularly for the physician when they ask, and then they said, like, while I guess watching the patient, you want to look at the collection chambers, the water chambers, and then the suction chamber as well. So all those things as you're helping out the patient. So some things to note too is just the bubbling. Like we said, if you heard it, for excessive bubbling, there could be a leak somewhere. Otherwise, I guess there is another reason that it could possibly be, would be, they said for a pneumothorax, since there's air already in that pleural space, what happens is that air, as that person's getting better, can leave and then enter the chamber, so you'll hear that as it fills there. So that was another reason that they mentioned. And then there was a question on what if the water in the chamber isn't fluctuating. So it could be that the lungs are re-expanding, or there's a kink, so you just need to evaluate those. So that was noted as well. So things that you want to do with the patient is also make sure that they're coughing, they're breathing deeply, and which helps make sure that the lungs are fluctuating. And then you want to reposition them frequently too, and then believe that is all the extra notes that we needed to know. So if the chest tube falls out, what you want to do is you want to with the tape, I actually want to do too, but so you want to cover it with a sterile dressing and then only tape it on 3 sides, and so that way the air can escape and you don't get that tension pneumothorax. And you want to notify the physician of that. And then when the system breaks, that was the one I was concerned with. That's where you want to put like an inch of the tubing into a bottle of sterile water, and then go ahead and get another system. And then for clamping, that's something that you need a doctor's order for, and you would most likely be helping the physician do that by instructing the patient, or either gathering supplies and then instructing the patient to perform the Valsalva maneuver, where you breathe in deeply, exhale, and then you bear down. That's just to help them or prevent air from entering the pleural space as that's being removed. And then But a lot of these things too, with you just want to make sure that with removing the chest tube and the clamping, just pay attention to the hospital policies, because that could be different for depending on the hospital. And I believe I mentioned everything needed, so thank you so much.